Good afternoon, everyone. At the onset, I'd like to thank Dr. R.K. Gupta for inviting me for this August gathering and selecting me as a speaker. Long COVID, I would like to give three narratives or patient-centric scenario. Being an International Patients Union conference, I thought probably this will be apt. The first scenario was an elderly person who was admitted in ICU during COVID with great difficulty, almost about 25 days in ICU. He survived. He had another reinfection. Again, he was admitted in the ICU in the second round of Delta surge. Again, during that time also, he survived. But subsequently, after 6 months, gradually, his heart function, which was low, did not improve much. Probably it was, ejection fraction was around 15 to 20%. There's not much of improvement. So this man underwent cardiac transplant, and he was fortunate enough he survived. The second scenario was my household worker who happened to be from a village, was working with us, so had mild symptoms of COVID, and he recovered. And during that lockdown period, he went and settled in his place. He did not come back to work even after 6 months to 1 year. He was, whatever work his family members were doing, agricultural work, he continued there. But subsequently, he started developing dyspnea and exertion and palpitations. So being known to me, he happened to approach me, and we could diagnose that again he was in heart failure. So because of my interaction with me, he was able to get his condition diagnosed, and proper treatment was being done, and even now also he is getting it. The third scenario is a young girl who was a state-level swimmer who had COVID, and subsequently she was doing extremely well. Post-COVID, whatever her parameters or whatever her timings were there, she was not able to reach up even to that one, in spite of all the efforts. It took almost around more than 2 years with multimodal physiotherapists and other. So she was able to come up to the. So this is how the long COVID has happened, and probably they were fortunate people that they survived and getting the treatment done. So, as all the panelists have said, multiple symptoms, and especially the cardiac symptoms of chronic fatigue, dyspnea and exertion, palpitations, heart failure, and even the coronary artery disease in this patient. ICMR has produced paper regarding this, but there's not much of data which says that on heart especially. We know that almost around 40 million people were affected by post-long COVID, and among them 10 million people are having post-COVID this thing. And heart failure and coronary artery disease are the major things which are to be needed. And we know microcoagulations, modification of the immune system have led to this. Government policy is needed, especially in terms of research to fund heart-specific studies, leverage pharma hubs in producing the molecules to treat these patients, and also to diagnose that this is because of post-COVID. There are no studies at all. There are no specific this thing. You got to also do the studies to know biomarkers, if there are any, to know that this is because of the post-COVID. We don't have, as our panelists have told, that it's only by exclusion that we have reached that this thing. And of course, in terms of patient care, we got to scale up the rural clinics like what we have in AIMS to move up to that Arogya Mandir at all places. The trained persons in ASHA workers, especially in identifying the long COVID through telemedicine, and create district level hubs. We also need to have advisory group, especially in managing these post-long COVID cases. And of course, prevention, push boosters, only 70% vaccination has happened. We don't know, but because of the vaccination, many of the people have been benefited, especially, at least even if they had COVID, probably it was at a lesser intensity. Long COVID as a second pandemic needs India's attention. And today I would like to wish you all, it's a World Heart Organization Day, and the theme of the today's this thing is Healthy Beginnings, Hopeful Futures. And this is a great beginning, and we look forward for a hopeful future. Thank you so much.